Global life expectancies are rising, but this exact progress is driving an unchecked surge in chronic diseases and disabilities. It is a process known as the epidemiological transition. As a developing nation's communicable disease burden falls, non-communicable diseases, or NCDs, take its place. The primary threats to human health are shifting away from environmental hazards and toward behavioral and metabolic risks. The wealth and development keeping populations alive are directly generating the defining global health crises of the coming decades. These emerging risks contrast sharply with the successes of the last 25 years. Coordinated global interventions and international targets set in the 1990s delivered massive health improvements. This descending line chart illustrates the global under-5 mortality rate since 1990. Driven by targeted improvements in sanitation and childhood nutrition, under-5 deaths plummeted by 50%. Similarly, the global burden of communicable diseases, like malaria and HIV/AIDS, has seen a steep, consistent decline since 2005. Targeted global funding is highly effective against time-bound, communicable, and environmental health risks. But surviving childhood means aging populations now confront massive burdens from non-communicable conditions, led by ischemic heart disease. Since 1990, maternal mortality dropped 30%, and under-5 mortality fell by half. Yet ischemic heart disease climbed to the #1 overall burden. Furthermore, years lived with disability remain stagnant, with low back and neck pain completely unchanged over a quarter century. Modern medicine is effectively delaying death from non-communicable diseases, but failing to prevent them. Health systems are now forced to manage massive, aging populations living with chronic illnesses. Researchers track these outcomes using the Socio-Demographic Index, or SDI. As national wealth and education levels rise on this index, conditions like chronic kidney disease actively worsen. This heat map of Mexico reveals stark regional disparities. National averages mask critical local realities, where southern states battle infectious diseases, while northern states face surging diabetes rates. Across the globe, behavioral and metabolic risks are escalating alongside development. High body mass index, elevated blood sugar, and drug use are increasing drastically. Public health systems are actively failing to mitigate metabolic risks in wealthier nations. To address this impending crisis, health ministries must urgently reallocate funding towards the fastest-growing modifiable risks, particularly obesity and ambient air pollution. Policymakers must study and scale the strategies of specific countries that currently outperform their expected health outcomes based on their SDI. Finally, health infrastructure must be redesigned to prioritize long-term chronic care and manage the rising tide of age-related disabilities. Rising income alone will not protect populations. Only deliberate, targeted interventions will decouple human health from the escalating risks of modern development.